Let's look at the differences in definitions between behavioral health, and mental illness. Mental illness is something that you will see in your work, so let's talk a little bit more about it. First, it's incredibly common. Millions of Americans have a mental illness, making it one of the most common health problems in the United States. The Centers for Disease Control and Prevention estimate that more than 50% of Americans will be diagnosed with a mental illness during their lifetime. 20% of Americans will experience mental illness each year, and 1 in 25 Americans live with a serious mental illness. Understanding how common mental illness is, recognizing the signs and symptoms of poorly managed mental illness, and knowing what to do when poorly managed conditions are observed are important for keeping both staff and patients safe in care settings. Before we get into the details of patient and self-care in mental health, we need to define several important terms that we will use throughout this module. Sometimes these three terms are used interchangeably, but the subtle differences are important to understand this topic. First, let's talk about behavioral health. Behavioral health is action and behavior focused. It includes all behaviors and the motivations that affect both behavior and well-being. Behavioral health includes mental health, stress, and substance use. Mental health is a type of behavioral health. It is something we all have. It is feeling, emotion, and thought-focused. Mental health is a state of well-being that enables us to go about our daily lives. Essentially, mental health is how we act, interact, react, and make choices. We can have good or bad mental health, and our mental health may fluctuate depending on the situation. In contrast to both behavioral and mental health, mental illness is not something everyone deals with. Mental illness is similar to physical illness. Not everyone has a mental illness, and some people have factors that make it more likely for them to develop a mental illness. It's important to note that mental illness persists over time. It is not limited to one bad day or even a bad week. The symptoms invade a person's life and negatively impact their well-being. Mental illness, like physical illness, can inhibit a person's ability to care for themselves. You may also hear mental illness referred to as mental health disorders, mental health struggles, or mental health conditions. Understanding behavioral health, and mental illness is important so we can best serve our patients and best take care of ourselves.